Welcome to Onslow County Today. I'm your host, Lisa Whitman-Grice, and we have some wonderful guests joining us. We'll be speaking with Jennifer Montefort from Onslow County Animal Services, and Jennifer's bringing her own guest. We'll also be talking with Dr. Diana Rashash about soils. We'll be speaking with Whitney Jezik from the Onslow County Health Department about the flu, and finally we'll meet Whitney Russell with the Onslow County Health Department and talk about heart health. We're so glad you're joining us for this edition of Onslow County Today. Welcome back to Onslow County Today, and joining us now is Jennifer Montefort from Onslow County Animal Services. And Jennifer, you have brought a very special friend. Who do you have with us today?
I have our friend Clyde. He's a 3-month-old male and he's available for adoption at the shelter.
Clyde is pretty fantastic, and he has just been as good as gold sitting here and is quite beautiful. I think he likes all the lights and everything going on. You're a good kitty. Jennifer, you've brought Clyde with us because as we're starting to sneak into spring, it's cat season. And explain to our viewers what that means.
We do see a pickup in intakes on our cats during the spring season. Unfortunately, lots of kittens coming in, so we do see an increase in cats during the spring season. So we do call it cat season for good reason.
So lots and lots as the cats are about, and then with that situation, then you have lots of kittens who, like Clyde and his sister, were abandoned kittens. Is that the situation?
We do see a lot of kittens coming in, a lot of well-meaning citizens bringing in kittens that they found. We do try and give them information if you do find small kittens to make sure that mama isn't around before bringing them into the shelter. We want to keep them as a family. It's their best key to survival at a young age, so we want to make sure that mama isn't around before bringing them into the shelter.
Very good. Now the other thing we need to remember is always as responsible pet owners, we can never stress enough if we do have a furry family member, cats and dogs alike, we need to remember to spay and neuter. Give our viewers just an idea about how important that is, not just to keep the population down, but for the health of our pets as well.
Absolutely. We definitely encourage spay and neuter. It's very important to keep that unwanted pet population down, as well as keep our pets healthy. It's been shown that it has very many benefits for both males and females as far as behavior and health to spay and neuter.
Very good. Now, if we want to adopt Clyde, or maybe he has some other friends there at Animal Services we might want to meet, what is the process that we want to follow?
So we were open for adoptions Tuesday through Friday from 12 to 6:30, as well as Saturdays from 10 to 4. He's getting a little antsy. We do have some amazing animals available for adoption of all ages, sizes, breeds. So you can come on in, meet our friends, spend some time with them, make sure it's a good fit, and hopefully bring a new furry family member home with you.
Excellent. Now, we also want to shift gears just a little bit, because once we do accept that responsibility of having that forever friend, forever family member at home, we want to do everything possible to keep them healthy. And one of the biggest things that we worry about, again, springtime, we tend to see an increase in this in the wild animal population, is rabies. So talk to us a little bit about rabies, the clinics that you offer, and what we need to do for our furry family members.
Yes. Rabies is is active in the area. We have seen several cases in Onslow County, so it's very important to vaccinate your pet, your cat, your dog, whether indoor or outdoor. It's very important and required by North Carolina law to have your animal vaccinated. Rabies is a virus that once it's present, is uncurable and lethal. So we want to take care of that by vaccinating. The good news is a vaccination is available, a 1-year or 3-year vaccination. You can get that either through Onslow County Animal Services or through your veterinarian. Onslow County does offer a rabies clinic Tuesdays, Wednesdays, and Thursdays for your convenience. The cost is $10. It is a 1-year vaccination, and you can bring in your cat or dog, no appointment necessary on those days, age 4 months and over, and we can get them vaccinated and protect your pet as well as the public in Onslow County.
Very good. And $10 to protect the life of Clyde.
Yes.
and those other, as well as your family members, and as you say, the community. And you said no appointment necessary.
Yeah.
And if we want, if we're just curious and want to know a little bit more, we can just always go to your website, correct?
Absolutely. We have information on our website about the rabies vaccination as well as adoption and all of our other programs.
Awesome. Now, we also want to talk about adoption in more detail, and that's because you have an event coming up this month, and that is your Adopt a Sweetheart event. Tell us about it.
We are very excited. We're going to have an in-shelter event on February 10th. That's a Saturday, so from 10 o'clock to 4 o'clock you can come in. We will have some reduced adoption fees, $80 for cats and $110 for dogs, and that includes everything you need: core vaccinations, spay, neuter, a microchip. So it's a great way to bring a pet into your family. We're really excited about having it at the shelter.
There have been so many studies done about the benefits of having that companion. I mean, we're going to talk later on in the show about heart disease, and it's even shown that it's good for your heart.
Yes,
it's good for your heart. So what a wonderful, wonderful gift, and a gift for these wonderful, wonderful creatures. Last but not least, if you are not able to adopt, maybe you're just not in a position, maybe you live in an apartment and you're not ready for that long-term commitment, but you want to be able to help in some capacity. Tell us a little bit about your foster program.
Yes, not a lot of people are aware of our foster program. It's something we're very excited about. We do have a foster program to where you can bring a pet in need. Normally our special needs animals, puppies, kittens, more vulnerable animals, senior animals. You can bring them home for a short time period, let them adjust, let them get socialized, and then we can get them out to adoptive homes. But it's very important for those animals, and it's a way to help the shelter when you don't necessarily have the time or means for a long-term commitment.
But it's a way of helping that pet transition.
Absolutely.
And assist them as well, and then assist animal services. Now, again, we want to remind our viewers, where is Animal Services located, in case they want to go over, meet with your staff, and begin the process of either adoption, fostering, or find out more information?
Sure. We're located at 244 Georgetown Road, so right next to Onwassa. We have a great new sign out front, so you can't miss us. And again, we're open from Tuesday through Saturday, so it's a lot of great opportunities to come in and find a new furry family member.
And you all have a wonderful website, but you also have a fantastic social media presence. Tell us a little bit about your Facebook and how people can find you.
Facebook is Onslow County Animal Services. Pretty simple to find. We put up some great photos, bios on our animals, adoption updates, so a lot of great information there, as well as information on our clinics and events.
Well, we appreciate your time, and we certainly appreciate you bringing Clyde with you today. He has been awesome.
Very well behaved.
We'll remind folks to go to your website, go to your Facebook presence, and remember that this is a great opportunity to look at adopting a sweetheart this month and bringing that forever family member home. So Jennifer, as always, thank you for joining us.
Thank you so much.
Welcome back to Onslow County Today. Well, you know what? We're on the verge of springtime. We can be hopeful, right? And now joining us is Dr. Diana Rashash, who is here to talk with us. Dr. Rashash, we are so happy to have you. We're going to talk about several things this morning, but the first thing is we always love for our guests to be able to introduce themselves, and please remind everyone about your position with Onslow County Cooperative Extension.
Thank you, Lisa, and it's great to be here today. I am an area specialized agent. That means I cover multiple counties, and I do water quality and waste management.
All right, so water quality certainly, and we know that water is everywhere here in Onslow County, but we want to kind of get away from the water just a little bit, although our story will be connected here, we'll come together. We want to talk a little bit today, though, about soils. And when we talk about that, you know, we want to really kind of first define soils, because certainly it's not unusual for somebody to say, when they garden, or if they're looking in their backyard, or if they're a mom and kids are tracking in, don't bring that dirt in my house. But we use a different term. Tell us what makes soil soil.
Well, to switch it around a little bit, dirt, according to a soil scientist, is displaced soil. So what you sweep up off your kitchen floor is dirt.
So kids do track dirt in the house.
They do. It is displaced soil.
Displaced
so
soil.
What is outside, naturally occurring where it formed in the ground, that is soil. And they all have names, and according to where they formed and how they formed.
Okay, so today we're not talking about dirt, we're talking about soil.
We are.
Now, when we talk about soils, here in Onslow County, you know, we're going to show a beautiful picture of a map with all kinds of gorgeous colors on it, and that sort of points out the different types of soils. Give us a really kind of a layman's understanding of soils and the different names, and really kind of what they're made up of, if you will, please.
Sure. The most simplest and common way people try to describe a soil is sandy or clayey. So I've got a really sandy soil and can't keep enough moisture in the ground, or I have a really clayey soil and everything keeps drowning. So those are the kinds of comments we usually hear from people. Or they'll talk about color. So the red color or the gray color. So in soil scientist terms, texture are your sand, silt, clay particles, how they're arranged, and it forms 12 different soil textures. If it's 100% sand, it's sand. If it's 100% clay, it's clay. If it's 100% silt, it's silt. And depending on the combinations, it makes up all those other texture classes. And there's actually one that is called a loam, and everybody with garden or yard wants to have that loamy soil.
All right, loamy soil is good.
Loamy soil, by definition, is that texture where the proportion of sand, silt, and clay feel like they're all equal. So it doesn't feel like a little bit more sandy or a little bit more clayey. They feel like they're all about in the same proportion to each other. And that is that loam block on that soil textural triangle.
Okay, so we talked about texture. Then let's talk a little bit about color.
Yes.
And, you know, we think, oh, I want that rich, dark soil, or I kind of like the way that orangey brown looks, but really it's not just aesthetics. Yeah. Each of those colors tell us something. So give us an understanding, if you will.
Sure, and I happen to have 2 soil profiles here.
Okay.
And a lot of times, one of the groups or industries that use soils a lot are soil scientists and environmental health specialists.
Okay.
And in the state of North Carolina, the perk test has not been done since the 1980s. What the environmental health folks do is they go out and they auger a hole 48 inches deep, and they're looking at the colors and the textures of the soil.
All right.
So these are two soil profiles going from surface downwards. This top one, you mentioned those dark colors. Well, that's not sand, silt, or clay for causing the darkness. It's the organic matter in the soil. And that organic matter is important because it's what gives those nutrients to the plants in that garden or that lawn to be able to grow. Then you have the various colors that occur below it. This particular soil profile's name is a forested soil, and it was dug from a farm near Richlands. And so this is about the plow depth layer, which is why it's such a sharp line. Normally you wouldn't see such a sharp line occurring. And as you go down deeper, you start seeing those reddish brown or yellow colors. So if you think of soil wetness by the M&M theory,
Okay.
M&M candies have those bright candy colored shells, whether it's red or yellow or orange. But when you get your M&M wet and that candy coating comes off, you have that white shell underneath. So our native soil particle colors are grays. So under certain conditions, when the water table is up high enough, long enough, that iron goes away. And it leaves that native soil color behind, which is the gray color. So they'll be going and digging on down till they find where the grays show up. And in the forested's case, it's way down here near the bottom. So that's where they would put the seasonal high water table.
Okay.
This other soil is much different. You can see it has a lot more nooks and crannies to it. This one's a lot smoother. This one has a higher sand content. This one has much more clay in it.
Very good.
And the dark color up on top doesn't turn gray the way the loss of that iron does. This is the black color stays behind because it's from the organics. So the water table could be way up here and it would still stay black. But if you notice right below the black is what color?
The gray.
It's the gray, that's right. So the seasonal high water table is at least this high or higher. So this would be a very wet soil. And down below it, you start seeing modeling colors, and that's with T's.
Right.
Yes. So you have portions where you still have some of the iron attached and areas where you have the iron all gone. So
Okay.
those are what they look for when they're trying to figure out where that seasonal high water table is. And these are vastly different, so they'd have very different uses.
Well, you mentioned that seasonal water table, and,
Yes.
and you know, for a lot of folks at home, they might be thinking if they're not particularly, you know, interested in a garden, I live in my house and have some shrubs and grass and we're all good. So for those who maybe aren't gardeners, they might be thinking, well, why do I care about soil, Dr. Rashash? I mean, I thought it was just dirt. So why do we really want to be aware of that soil that we're walking on, what's beneath our feet, if you will?
Well, it comes to uses, and it's whether it's an appropriate use for it. Is it suitable or not suitable? So septic systems, there you have to have well-drained, aerated soil because you need that oxygen in that soil to be able to help treat the pathogens and utilize the nutrients that are present in those waste materials that are trying to work their way down through that soil profile. If the water table is way up high into that septic system, you don't get that proper treatment going on, and that is more harmful to both the environment when it gets out into waterways, adds excess nutrients, you end up with algal blooms and fish kills. But if it's surfacing up into your yard, your dogs or your children go out back and play, they could be into those pathogens and transport them back into the house.
So you've got that squishy soil, which is always a terrible, terrible sign. Always.
You do not want your drain field to be squishy.
Exactly. To use the layman term, squishy. That's one
Squishy.
of those,
Yes,
one of
that's
those
definitely a
high-tech
term.
terms. So here in the county, we do have this mix, but we also have great resources for understanding those soils. If I'm in the community and I do want to build a new house, and I want to know about soils, or I am that gardener and I want to know do I need to amend it in any way? Do I need to work with it in any way to make it more productive? What are some of the resources? Who can I reach out to?
Well, if you're looking at buying property and it is going to be put onto a septic system, one of the places you'd be stopping off at is environmental health.
Okay.
So that the environmental health specialist can go out there to look at the site. Now, if you have a 15-acre location, they're not going to check all 15 acres. They're going to want to know, okay, where, relatively are you planning on putting your house, so that they have an idea about, where you'd be wanting to put that septic system in there, and they would check those areas around there to find out if there is a site that's suitable or not suitable. If you're thinking of putting in a pond, whether you have a farm or you do have that lovely 15-acre site and you thought a pond would be a good thing, well, if it's a clayier soil, you have a better chance of that water staying put than if you have a great big sand pile. It's not going to be there. So again, different suitabilities for
Exactly.
that. If you're planning on putting in a garden, our Master Gardener volunteers and our horticulture agent, Lisa Rayburn, are very good at talking to people about soils and soil sampling. And soil sampling is very important. It lets you know what the pH of the soil is, as well as if it's needing any phosphorus or potassium to go into that soil. When you sample, you're going to be sampling in that top area of that soil, and you want a good representative of what that area is going to be. The other thing that it will tell you is if you're digging out there and you're thinking of putting in your vegetable garden, if you're finding grays very close to the surface, that might tell you need to put in a raised bed garden.
Right. So lots of great advice from lots of different resources in the county. And really, it really just is about digging deeper, right?
It is, and people, if they're not in an incorporated area, if they're out in the county, they're able to go online to the Web Soil Survey and look up their property and see what kinds of soils there are beneath it. You can't do it in the incorporated, like City of Jacksonville, because usually it's just listed as being urban fill.
Okay. Well, as always, you have given us a lot of great information, really timely, as we are starting to think about springtime and getting outside. We want to remind everyone about how to find out more information. So please tell us where Cooperative Extension is located for folks who might not be aware of that. And also if you can give us your direct telephone number there at Extension so that people can call the Extension office and get more information and get the kind of direction that they need.
Sure. We're located at 4024 Richlands Highway.
Okay.
So right there between Jacksonville and Richlands.
All right.
And our phone number is area code 910-455-5873.
Well, Dr. Rashash, you always give us a lot of great information when you come to visit. Thank you, as always, and we look forward to our next visit.
Thank you for having me, and I have a gift for you. It's called Have You Eaten Any Soil Lately? Letting you know your food comes from the ground and the nutrients that it pulls out of it.
Awesome, thank you so much. And yes, absolutely, especially when we eat locally. We know we're eating our local soils. So
Okay.
Dr. Rashash, thank you.
Thank you.
Is it cold? Is it flu? We don't know. That's why Whitney Jessic is here from the Onslow County Health Department. Whitney, first and foremost, you always provide us the best information. So we are so glad that you are here today to keep us straight on, is it a cold? Is it the flu? But more importantly, what we need to do to prevent it. So we're going to talk today about the flu, what defines it, how we know what it is, and all the steps we need to take to make sure that we don't bring the flu into our house this year. So first and foremost, what is the flu?
Well, the flu is defined as a respiratory infection created by the influenza virus. And it's spread through droplets. When somebody coughs or sneezes, it's on their hand, they touch a surface, you touch that surface, you touch your face. There's the common strands, or the influenza A and B. Those are the ones that cause those drifts every year, that when they're creating the flu vaccine, that is that balance that they're trying to find to create the most impactful vaccine that we can give. The only thing that's predictable about the flu season is that it's very unpredictable.
Exactly, it kind of changes and really share with us a little bit about how the flu does morph a little bit, because we do know that it changes character and personality
Well, it actually mutates each year.
Okay.
That's that slight shift or change that occurs to keep that virus alive and ever more irritating all of us, keeps scientists busy, keeps vaccination companies producing vaccines for us. Because of those slight shifts, that's when your body meets the flu, it goes, wait a minute, I think I know this. That's how really the vaccine works. It reminds your immune system when you get it. It takes about 2 weeks for that flu vaccine to take effect. Usually the flu vaccine gets a bad rap because somebody goes, I got the flu shot and it made me sick. Well, it's not a live virus. We don't use that vaccine anymore, which was the flu mist. We found that it really wasn't as effective as we hoped it would be. So when somebody gets the flu vaccine, we give it to children that are 6 months or older. We give it to pregnant women. So with those two groups of people right there, you know the flu vaccine is safe. Then we have a special one that we give to people that are 65 years and older. It's the high-dose flu. So when you think about, we give it to babies, we give it to people that are pregnant, we give it to older people, and then there's the baby boomers like ourselves that we give it to. Okay. And when you think about the flu vaccine, if you started getting it, for example, when I was in nursing school 30 years ago, it started becoming a requirement if you were going to rotate through hospitals. So each year for the last 30 years, I've actually gotten a flu vaccine. So I have this immune system that is racking and stacking those flu vaccines all on top of each other, which creates an immunity that's this big versus a small immunity. The cool thing about a pregnant mother, when we give that mother her vaccine, when she's pregnant, she creates an active antibody. When the child is born, that child has a passive antibody. In other words, they didn't create that antibody on their own immune system. They basically borrowed it. It's good for about 6 months. So that's when we start vaccinating babies directly. They get half of a dose, and then 1 month later, they get the other half of the dose the first time they're ever exposed to the flu vaccine. And that creates an immune system that is challenged and yet still safe because you've got a little bit of that immunity left over from mom.
And the whole idea really is to create that armor.
Correct.
To create
put on that shield.
Put on that shield, create that armor against this virus. And I think that that's one thing we also need to let people know is they assume oftentimes, oh, I'm sick. I'm going to go to my doctor and I'm going to get some, antibiotics, and in 10 days I'm perfect. But the flu doesn't even care about
Doesn't work like that.
Doesn't work like that. This is a virus. We need to put on that armor in advance to protect ourselves from that virus. Now, give us an idea. I'm starting to feel, it's Friday afternoon, and I'm thinking, why am I starting to just feel kind of cruddy? To really be medical about it, Whitney, I'm starting to feel pretty cruddy. How do I know that I have the flu versus just a really, as my grandmother would call it, a bad cold?
Well, the biggest one between the two is you're going to have fever. And for an adult, 102 fever. For a child, you're going to have that 103, 104. The funny thing about you starting to feel bad at work, you've already been exposing people for the last few days. Children up to 10 days before they start having symptoms. So whoever was sharing your world with you was also sharing their germs with you. And that's the sad part about it. By the time you're starting to have symptoms, you've been exposing people for a couple of days. The cool thing about the flu vaccine is it's going to help you have that flu for a shorter period of time. So with a cold, that flu vaccine isn't going to help you. You're going to have some very mild body aches. Now, I realize that sometimes people feel they got to die to get better if they have a cold, but we call it the common cold for a reason. Most people don't die from it. The flu, that's completely different.
Right.
Your body aches are going to be where they keep you in the bed. You're going to run fever, where a cold you're most likely not going to. If you have stomach flu, you're going to have some of those stomach upsets. You're going to have upper respiratory, a cough, not just a cough like with a cold where you can kind of clear it, but this cough is going to sound like your toes are coming up. Another one of those profoundly medical terms. And then you're going to have probably some difficulty breathing, but the greatest impact is going to be your fatigue level. With a cold, you can actually get up and go to work and things like that. Everyone around you does not want you there. That's when you call your supervisor and say, I have a cold. The defining moment for the flu is this. You go and you have a flu test, and they actually test you for the flu, and it comes back positive. So with a cold, you're going to take things that are over the counter. And I know we don't promote those medications, but those things that are going to relieve your cough, your colds, your runny nose, and some of those body aches. With the flu, we have some antivirals. There's a difference between antibiotics and antivirals. Antibiotics take care of bacteria. With the flu, it's a virus, unless you now have a secondary infection, and that usually comes later after you've had the flu for a few days, and those secretions start changing colors, and that cough is now settling in your lungs, you're now having wheezing, and now you have bronchitis. There's a progression of the flu that leads to antibiotics, but normally it's just antivirals. And what they're going to do is they're not going to heal you from the flu. But it's going to cut that time period off. So if you have your flu vaccine and you take antivirals, you're still going to feel bad, but you're not going to feel as bad as long, and you're most likely not going to have a hospitalization related to it. The flu shot has gotten a bad rap in its ability to prevent the flu.
Right.
It doesn't prevent the flu. It's like getting in your car and putting on your seatbelt. You're not going to know for sure whether you're going to come in contact with another vehicle and be involved in a motor vehicle accident. Your body has built some antibodies so that when it comes in contact with the flu, with your immune system, together they can hopefully fend it off. If not, then you've got something on board. You've got your seatbelt on when you come in contact with it on a day that your immune system cannot. So it's not that it's the end all be all, but I'll tell you one thing, it's better to have it than not have it.
Well, you know, again, it's that prevention and trying to lessen those effects. Now, I didn't get my flu shot, I'm home, I'm sick, but it's just the flu, right? I can stay home and I can take my over the counter and I can have my chicken soup and sleep. And, you know, in 3 to 5 days, I'm going to feel better, right?
Most of the time, yes.
But
unless you have asthma or you're a diabetic, type 1 or type 2, if you have gestational diabetes, if you're pregnant, if you're more mature in age. I don't like to use the word elderly because I have some friends that are older than I am and they can run circles around me. Right. It's that compromised immune system that's either if you have an autoimmune disorder, Crohn's, if you have lupus, things like that make your body not fight like it normally does. Right. That's when you pick up the phone and you call your provider. That going to the emergency room is probably not where you belong. Those people that belong in the emergency department are those people that have very high fevers. 102, 103 as an adult. Right. You're having difficulty breathing and you're having other signs and symptoms in addition to those things. Feeling like you feel bad is completely different than being a medical emergency. Right. But when in doubt, always go to the doctor or go to the emergency room.
All right. Now, the next thing we want to talk about is, I thought I could weather this. I was home, I was sick. I'm not getting better. Maybe I do have one of those secondary infections. Talk about the complications then that come with the flu, because the flu never comes by itself.
Oh no, it always brings its friends. It's like chaos and mayhem. The problem with the flu is it's difficult when you feel that bad to see that light at the end of the tunnel, that ever-changing. So when you're thinking about how bad you're feeling right now, it's a cycle. The cold is very similar to it in the aspect that you have those first few days where you're beginning to feel kind of bad, and then you have those couple of days where you feel really bad, and then you have those couple of days where you're starting to feel better. It's a cycle. It's like a 10 to 15 day cycle. So if you're been into that cycle a few days being 3, 4, or 5, and you're not beginning to feel ever so slightly better, that's when you need to pick up the phone. Okay. Because it's getting worse. Those secretions are changing. When you're coughing or you're sneezing or whatever you're blowing out of your nose or whatever is changing colors. you find that you cannot sleep because of the cough that you have. You're coughing, you're vomiting, your skin is getting dry, you can pick it up and you're losing what we call turgor. But a lot of people go, I just don't feel like I'm getting any better. You know your body better than anyone. So if you're not getting to a place where you're making any forward motion, or better yet, the people around you are growing concern about the fact that you're growing weaker and weaker rather than not moving a little bit forward towards healing every day, those are red flags. Continued fever, true fatigue where you cannot get out of bed. You need assistance to get up and go do any of those activities of daily living.
Now, to really be quite serious about this year, the flu has really taken a very serious turn.
Correct.
Nationwide and here in North Carolina, we've seen folks sadly succumb to the flu. Tell us, people now, we didn't think about this in October and November, and now we're starting to see these very serious complications and even some fatalities. Talk to us a little bit about the statistics, if you will, and certainly who we're seeing affected by this, because I think we've also been a little bit surprised.
Well, nationwide, annually, we have about 200,000 hospitalizations related to the flu. That's that secondary thing that happens, those bronchitis that turn into bronchial pneumonias. You can get vaccines for pneumonias. It's called Prevnar 13, and you can get the Pneumovax 23. Most of the time, people don't get those until they're in their 60s.
Right.
But Prevnar 13 actually is for 50 and up. If you've ever smoked, lived with a smoker, ever had any kind of respiratory issues, recurring bronchitis, had asthma as a child, those are things that create those landmarks for you to be able to get that vaccination. Okay. And that helps in that process. It keeps you from getting one of those secondary infections. But like you said, we've had flu deaths, and we've had one flu death in our county. In our state, we've had 2 pediatric flu deaths, and these were relatively healthy children. Something's happening with the immune systems this year, and with this particular strand of flu. As I said before, the one thing that's predictable about the flu is it is unpredictable. The best thing people can do is get their flu shot early. Like you said, we're late in the season, but it's never too late.
Right.
It takes 2 weeks to become a full effect. So you've got 15 days of that window of opportunity. But the moment you get your flu vaccine, it starts working. Your immune system starts kicking in, and it starts building that shield in preparation for coming in contact with it. Get your seatbelt on, and you start moving forward.
Now, if we do, like as you say, it's not too late.
It's not.
We can go get our flu vaccine. Tell us how Onslow County Health Department can assist us with that.
You can walk into the immunization clinic. We are open Monday through Friday from 8 to 5. We take our last walk-in at 4:30, because if everybody walks in at 4:30, we close at 5. So we truly do try to respect our staff and get them in and get them out. But we have later hours on Thursdays. We're open till 7:30. Our last walk-in is at 7:30. We close at 8, so that gives us time to vaccinate those people that work and those 8 to 5 jobs. But we also want to be available in the morning for that person that's coming off of the night shift, wants to get their flu vaccine and then go home and sleep. So we do provide these services. We've done many outreaches out into the community, and to be able to walk in, if you are 0 to 18 years of age and 364 days, we have a state flu that we can give you. If you are an uninsured pregnant woman, we have a flu vaccine to give you. Fortunately and unfortunately, we carry private flu vaccine for anyone that's over 18 years of age. Okay. When you turn 19, you age out of those free state vaccines. So we offer a purchased dose of flu, and we take many different insurance companies.
Okay, very good.
I'll read the list.
All right,
I have to put my glasses on, pardon me for just a minute to do this. We take Medicaid, Medicare, Part B, TRICARE, Blue Cross, Blue Shield, Cigna, United Healthcare, and Health Choice for Children. And we'll bill your insurance companies. You may get a small copay for that vaccine. I think it's $10 or $15, maybe $20. But other than that, we have plenty of flu, and we are all ready to vaccinate the people in our community that have not received the flu vaccine. If you've received the 2017-2018 flu vaccine, you're good to go.
All right. So we want to remember several things. One, prevention is key.
Yes.
Putting up that shield. Two, if we do become infected with the flu, take all those necessary precautions. Don't go to work, don't go to school, stay home. And if you are not getting better and you feel, first, if you think you have the flu, seek medical attention. You can take those antivirals, but you do need to have those early for those to have effect. And then if you do not feel yourself getting better, certainly seek medical attention in the event of one of those secondary infections.
There was a recent study that those people that care for people that have compromised immune systems, they're actually giving the partners of those folks or the caregivers of those folks the antiviral as well, so that they don't develop the flu and bring it into the environment.
So again, that precaution.
Correct.
That precaution. Whitney, as we kind of close out and reminding folks yet again, it's not too late to get your flu vaccine. Don't be afraid of the vaccine.
No.
Don't be afraid of the vaccine because it's protecting you. Let's remind folks where Onslow County Health Department is located as part of our CHS, or our Consolidated Human Services Complex.
612 College Street.
Okay.
It was where the original hospital used to be.
Okay.
And what's funny is back there is now where our parking lot is being built, and there's this beautiful 3-story building that we're all in the same house. We're almost like one-stop shop for many people in our community, which is a blessing to us to have this new beautiful building. But it's also a blessing to those that come there because it's a beautiful facility. You can get more things done with having all the departments in one building. But I want to go back to the basic, most fundamental way to prevent the spreading of the flu. Wash your hands with soap and water. Sing happy birthday as you're bubbling up in the sink with warm water. Rinse it off, dry your hands. If you cough or sneeze, the best way to prevent the spread is to cough or sneeze into a tissue and then throw it away immediately and wash your hands. And if you don't have a tissue, truly into the fold of your sleeve, actually sneeze or cough.
All right.
But hand washing is the simplest, most effective way to keep from spreading it, because what do? We put our hands up to our faces, we rub our own nose, we wipe our eyes, and that's how we actually infect ourselves.
So first, wash your hands.
Yes.
Get your vaccine.
Yes.
Then if in the event,
Stay home.
Don't share.
No.
Don't share. And always the Onslow County Health Department is there to answer your questions. So even before we go over to the beautiful CHS building, before we get our vaccine, we can certainly look at your website or give you all a call. You have wonderful folks there who can help us out and give us great direction. Whitney,
Would you like the telephone number for that?
Yes, absolutely.
Area code 910-347-2154.
Okay.
Again, 347-2154.
Absolutely. And that's exactly, as we kind of close out, I would love for you to just remind our viewers just how important it is to have this vaccine and what it means to the community and to their family.
Sometimes it's just as simple as it's about your health and living your best life. And if you get the flu, you're going to be out of work for 15 days, most likely. So do you want to take a 2-week vacation to some beautiful warm place, or do you want to be at home spending your 2-week vacation with your sick leave? Do you want to run the risk of having a life-changing event occur in your home because you didn't get the flu vaccine and you lost a loved one? But most of all, who wants to be sick?
Exactly.
I'd rather go someplace warm and sit on a beach and use my vacation and not be sick.
Absolutely. That's the perfect way to end our segment. Get your flu vaccine.
Yes.
That way you can take vacation and have some fun instead of being sick in bed.
Absolutely.
Thank you, Whitney Jezik, as always.
Thank you for having me. It was a joy.
Welcome back to Onslow County Today, and we have a new face joining us. We have Whitney Russell with the Onslow County Health Department. Whitney, we're so glad you're here today.
Thank you. Glad to be here.
Now, this is February, and we are talking about heart health. and heart disease and how to prevent it. And the first thing I always like to do with our new guest is really get to know them. And so tell me how long you have been with the Onslow County Health Department.
So I've been working as a nutritionist with the WIC program for the past about 15 months now.
Okay. And you said you were a nutritionist. Tell me just a little bit about your background. Where do you come from?
So I originally come from the eastern part of Virginia.
Okay.
And I received my bachelor's in nutrition and been working in nutrition ever since, really.
All right. Now, you know, we spoke with Dr. Diana Rashash earlier in this show about soils, and you know, she asked me, it was a funny question, she said, have you eaten your soils today? And really talking about the plants and that everything is, you know, kind of nutrition based. You know, have I had my soils today? And so we're going to carry that forward and talk about the importance of good nutrition a little bit later on in our conversation, because that's really the foundations of who we are. And so we want to talk about heart disease and then those things, those preventatives, those things that we can do, those good practices that you're going to tell us all about. So the first thing is, let's explain to our viewers a little bit about heart disease or cardiovascular disease.
Okay, so cardiovascular disease or heart disease is actually a collection of a few different diseases or complications that involve the heart or the vessels surrounding the heart. So things like congestive heart failure, and strokes and arrhythmia are a common part of heart disease. So it's kind of a blanket term.
Exactly. So it can take many different forms. You know, it's certainly we tend to think of a heart attack or some sort of distress associated with our heart. But as you say, it takes many forms, and it also has many contributing factors as well, things that can affect our heart. Talk a little bit about those kind of contributing things, like type 2 diabetes, for example, or hypertension or high blood pressure.
Right, so hypertension, high blood pressure, high cholesterol, and diabetes are all risk factors for heart disease. So I think we can all think of at least one person or the complications of those diseases. So those all play a factor in developing heart disease.
And also probably, you know, we always think, but that, you know, we hear of someone who's perhaps had a heart attack and you think, but they were so healthy, they did everything right. And so sometimes genetic plays a part in that as well, correct?
Yes, genetics plays a very big part, your family history as well, and some factors that you can't control, such as your age and your race.
Okay. Now, there are things we can control, like what we eat, how much we move, if we are a smoker or not. Talk about those contributing factors that we can change or that can make a difference.
And that's my favorite part, the things that we can change.
Absolutely.
So they are our lifestyle modifications that we can make. So like we had mentioned, smoking, definitely eating healthy is another one, and then just getting more active in general.
Okay, so let's start with your really kind of area of expertise, and that's nutrition. What sort of choices do we need to be making? And you know, just as we've kind of about a month into the new year here, it's not too late to make resolutions. What are some things that we can start doing or thinking about?
Absolutely. It's never too late to start making changes, especially when it comes to your diet. So for your general health, we do recommend eating a well-balanced diet with lots of fruits, vegetables, whole grains, low-fat dairy products, and some lean proteins as well. Okay. So the concept of My Plate is one of my favorite concepts. It's been updated from the pyramid that everyone's familiar with. So making your plate nice and colorful in general for heart health.
Yeah, and I was going to say that, you know, we all kind of, or I grew up with that food pyramid with, I think, butter at the top and kind of that foundation, but you've changed it a little bit. As you say, it's all about color. And I think that that's a great concept. Give us some great suggestions, because we also, we want to make changes, but we also want to make sure that that plate that we're giving our children is bright and colorful as well. And so give us some ideas about things that we can serve or make to make that rainbow as beautiful as possible.
Right. So most people do pretty well at dinner time is having, you know, a protein, a starch, and a vegetable, but I really encourage people to apply that to their breakfasts and lunches as well. So for breakfast time, if you're going to eat something like eggs, make sure that you're balancing that out with a piece of fruit, maybe a small cup of yogurt as well. So picking at least 3 of those food items to help to round out your diet.
And you know, I think that we all have kind of grown up with the idea since the turn of the last century that, you know, breakfast can be a bowl of cereal and I'm moving on with my day. But we've kind of again turned that on its head, and people are mixing up even what they're having for breakfast. Talk to us a little bit about some of the innovative ways we can make those changes and change breakfast a little bit.
Absolutely. So yeah, no longer is the bowl of cereal plenty. We try to get a nice, well-balanced meal in. So choosing a little bit of protein. Smoothies for people that are on the go are a great way because you can not only add in some protein, your dairy, your fruits, but also your vegetables. A lot of people don't realize that you can throw in your spinach or kale, and it blends beautifully with your morning smoothie.
You know, when we think about kale, sometimes kale, you know, it has gotten a bad rep. But really, kale, spinach, those dark leafy greens make a huge difference in our daily diet choices, don't they?
Yes, they do. They are chock full of nutrients that everyone really needs. So definitely helping with our iron levels. Vitamin K is pretty prevalent with those food items as well, and fiber too.
All right. Now, we also mentioned whole grains, and that's not just any, you know, we hear a lot about that, but we need to read labels when it comes to whole grains. Tell us a little bit more about what we really want to look for. Just because something says whole wheat isn't necessarily whole grain, correct?
Correct. The manufacturers do a little bit of wordplay with us for sure, so it's always best to turn that label around, and you're going to be looking for that first ingredient to be whole grains, or whole wheat on that first ingredient.
All right, so making sure we read labels, looking for color, and then what about when we talk about lean meats or proteins, again, let's give folks some specifics, some things that they want to, some choices they can make that are pretty easy when they go make their choices in the grocery store.
So everyone thinks of chicken typically with our lean proteins, and that is a great source of lean protein, but red meat is okay as well in small amounts, and the best way to look for the red meat is the least amount of marbling, or that kind of white waxy substance that you see in your in the red meat display. So choosing cuts that have a little bit less than that. And also seafood is a great option. At least 1 to 2 servings a week of seafood is considered healthy, heart healthy as well.
Very good.
For most healthy individuals. And then on the flip side, looking at more vegetarian options as well, a little bit less meat. Americans tend to eat a lot of meat, which comes with a lot of fat. So looking for protein sources in beans and in eggs as well.
All right. And again, you know, thinking about how that food pyramid changed, I can remember 25, 30 years ago when eggs really had a bad reputation. Oh, we didn't need to eat eggs. They have so much cholesterol. But eggs have changed the way in which they're produced. Tell us a little bit about the changing perception of the egg and how we can introduce that in some different ways.
Yeah, so definitely the perception of eggs have certainly changed. We're finding now that the cholesterol that we are eating is not having as big of an effect with our cholesterol levels.
Okay.
So eggs are considered good again.
Eggs are good again. Okay,
eggs are good again.
All right. And again, I always think, you know, the key is always about moderation. Always about moderation. Now, you work with WIC, you mentioned.
Yes.
And so education is so much a part of what you offer to your young families. If you were to, and oftentimes they are young families, so they might not be thinking, about heart health. I mean, you know, I'm young, I'm healthy, and this is, you know, not something that I'm really thinking about right now, but they need to, again, set that solid foundation for overall health, not just heart health. What is some advice that you give to your families as you're educating them about great food choices?
So I always encourage my clients to start small. Nobody wants to change their entire diet overnight. So just finding one small thing that they want to work on. So maybe it's switching from the white breads to the whole wheat breads, and really the recommendation is only half of their grains to be whole wheat. Okay. So it doesn't have to be everything. So I just encourage them to start small, one food item at a time.
All right, so baby steps.
Baby steps.
Baby steps. And when it comes to heart health, in general, that can be advice we can follow about other things. I mean, certainly some lifestyle choices like exercise, for example. It's not that we need to go join the gym tomorrow and work out like we're going to be in the Olympics. What are some things that we can do just to make, again, those little changes?
Little changes.
Little changes.
Yep. So 5 to 10 minute burst of activity spread out throughout the day is typically enough to help you meet at least 30 minutes of physical activity. So taking the stairs, maybe walking your child to the bus stop instead of driving, just small changes like that.
Small changes, and just getting outside and taking a walk is good for our hearts and good for our minds as well.
Absolutely.
Now, we did mention that you work with WIC, and we did not want to leave our time together without talking about a new initiative you all are introducing, and that's the eWIC program. Tell us about eWIC.
So Onslow County was a pilot program to start with the eWIC that they've rolled out. So now our clients are able to purchase their WIC benefits discreetly and electronically instead of with the big paper vouchers. We're finding that it's been very successful with a lot of our clients in getting everything that they need much quicker.
All right. And again, as always, if folks have questions, they can certainly go to your website or give you all a call. Tell us a little bit about how important it is to you to help families get on that right start, and how important WIC is to helping them make these great decisions, what it gives them access to.
It gives these moms and these kids a great start to life, honestly. So we are trying to catch them young to teach them the best ways to eat, and it really just sets a chain reaction for the whole family.
So that when they go forward, you've given them the foundation.
The tools that they need, so that way as the child grows, or as mom gets further along in her pregnancy, and we'll hopefully start with this new baby with a good start to life.
Well, excellent. Well, Whitney Russell, thank you for what you do. Thank you for the great information that we all need to keep in mind and make those little changes so that in the future we'll have certainly a much more healthful and happy life. So thank you for sharing that with us and for joining us today.
Thank you.
Thank you for joining us for this edition of Onslow County Today, and a very special thank you to our guest, to Jennifer Montefort, and of course Clyde from Onslow County Animal Services, Dr. Diana Rashas, for sharing with us about soils and how important they are in our decision making, whether where we build a house or how we plant a garden. To Whitney Jessick, we say thank you for telling us all about the flu, how to prevent it, and just in case we get it, what we need to do. And finally, to Whitney Russell, who joined us today to talk with us about heart disease and making great choices for heart health. As always, we are grateful that you are joining us for Onslow County Today, and we invite you to get out and explore your Onslow County today.